Every year on January 1st, there are changes to Medicare deductibles, premiums, and Medicare Advantage plans. But in 2025, there are more changes than usual. Hi, I'm Larry Goist, owner of LMS Insurance Group, where we help seniors navigate the Medicare maze. So in today's short video, I'm telling you guys everything you need to know about the changes coming to Medicare in 2025. And I'm going to talk about four real basic topics. So number one is, what are the changes to the Medicare premiums and deductibles for 2025? Secondly, I'm going to tell you about the changes to Medicare Advantage plans that we've seen in the upcoming year. Thirdly, I'm going to tell you about changes to the Part D prescription drug program. And then finally, I'm going to tell you why I think we've seen so many changes in the upcoming year, and that's all coming up next. Hey, before I dive in, don't forget to like our channel. Definitely subscribe if you find this helpful. I really appreciate you doing that. Thanks. So every year, Medicare raises its monthly premium and it raises its deductible for people under original Medicare. So the Part B premium, which is the monthly amount that is withheld from your Social Security check to have Medicare Part B, in 2024, the standard Part B premium is $174.70. Now in 2025, they have upped that to $185. So if you want Medicare Part B, the standard premium is $185 starting January 2025. Now, there's also a Part B deductible. So before Medicare will pay anything for outpatient services on original Medicare, you have to meet a $240 annual deductible. That was the 2024 number. Now in 2025, that is now going to be $257. So whether you have original Medicare or you have original Medicare with a supplement, you will have to pay the first $257 under Part B. Okay, so Part A is your inpatient coverage. So the most notable deductible under Part A is your hospital deductible. So in 2024, you had to pay a $1,600 deductible if you were admitted to the hospital. Now that would cover your first 60 days of confinement in the hospital. So whether you were there for 2 days or 30 days, you would pay $1,600. Now in 2025, the Part A hospital deductible is going to be $1,676. So you will pay that amount, $1,676, and that covers your first 60 days of hospitalization. So if you're in the hospital more than 60 days, you start paying a daily copay on day 61. Now, in 2024, that copay was $408 per day, days 61 through 90. And in 2025, the daily hospital copay is going to be $419. Now, Medicare Part A also covers skilled nursing care. And under Part A, you get your first 20 days for free at a skilled nursing facility, and then a copay kicks in on day 21. So in 2024, the copay day 21 to 100 was $204 a day. And now in 2025, the copay days 21 through 100 is $209.50 at skilled nursing. So usually these increases are related to COLA, the cost of living adjustment, and it's all kind of relative to your increase that you get in your Social Security benefit. So to summarize this section, your Part A deductible for 2025 is going to be $1,676. Your daily copay, days 61 through 90 at a hospital, is now going to be $419 per day. Okay, under Part A skilled nursing facility, day 21 to 100 is now $209.50 per day if you were at a skilled nursing facility. Okay, under Part B, the new Part B premium is $185 a month. The new Part B deductible is $257 annually, and these are all your new numbers for 2025. Okay, so those are your changes under original Medicare, but what about the 54% of Medicare beneficiaries that have Medicare Advantage plans. Well, these changes were more drastic than we had seen in years past, and I don't want to sensationalize it. It's not night and day, but we certainly saw more changes for 2025 than we had the previous 5 or 6 years. So the first thing to note is that under Medicare Advantage, 5% of enrollees, an estimated 1.4 million people, had to find a new plan. Why did they have to find a new plan? Because 5% of beneficiaries, the plan they were enrolled in, it left the service area or it just stopped offering the plan altogether. So 5 in 100 people on Medicare Advantage, they had to find a new plan for 2025. So in total, there are 6% plans less that are offered in 2025 versus 2024. Okay, now the other significant change we saw under Medicare Advantage was a rollback on some of the extra supplemental benefits offered by these plans. So if you're not familiar, Medicare Advantage plans can offer benefits like transportation, telehealth, they can offer monthly grocery cards, over-the-counter allowances, amongst various other benefits. And this is where we probably saw the biggest change for 2025. Now, all of the data that I'm going to tell you about in this section, I found in reference to the Kaiser Family Foundation, and all my sources are linked in the description below. So in 2024, 85% of MAPD plans offered an over-the-counter allowance, and that number is down to 73% of all plans in 2025. Now, Medicare Advantage plans that offered telehealth service had a drastic cut. 73% of plans in 2024 offered telehealth services, and that's down to 53% of all plans in the 2025 calendar year. Now, some Advantage plans would offer a meal benefit after a hospitalization. So if you had an inpatient hospital stay or you were at a skilled nursing facility, some of these plans would come offer you meals. So in 2024, 73% of plans offered some type of meal benefit, and now that is down to only 65% of plans are offering this type of service for the 2025 year. Now, if you need rides to the doctor or rides to the pharmacy, 36% of Medicare Advantage plans offered a transportation benefit in 2024. Now that number is down to 30% of plans that offer that benefit for 2025. Now, seniors love their gym benefit. Some companies call it a different name. However, 98% of Medicare Advantage plans offered a free gym benefit in 2024. And that's still a really high amount in 2025, where 95% of plans will still offer some sort of a gym benefit in the coming year. I think the other significant cost that I saw rise was the maximum out of pocket. The average nationwide rose about 6%. So the median maximum out of pocket, which is the most you can pay in 1 year, the median was $5,000 in 2024. We're now in 2025, the median maximum out of pocket is $5,400. Now, the only real benefit that I saw that was increased in 2025 was plans that offer a Part B rebate. So in 2024, 19% of plans offered had some sort of a Part B rebate, also known as a Part B buyback. And now in 2025, almost 1 in 3, 32% of plans offer a Part B rebate, which is also known as the give back benefit. So oddly, that went up in 2025. There's more plans offering a Part B rebate, where almost all other extra benefits are reduced in one way or another on the Part C Medicare Advantage plans. Okay, so what about the changes of the Part D drug benefit? Well, the most significant change is that there is now a cap on prescription drugs. if you are enrolled in Part D of Medicare, you cannot pay more than $2,000 annually for covered drugs. So what we have seen in the coming year is a lot of Medicare Advantage plans with Part D. They have added a small deductible to compensate for the fact that they have to pay for more of the drug coverage. I don't have a hard number on this, like I don't have the data, I couldn't find it, but in Ohio, Florida, Pennsylvania, the places that we work most, a lot of Medicare Advantage plans have added a drug deductible. Now, the drug deductible normally only applies to like a tier 3, 4, or 5 drug. So just because your plan added a drug deductible does not mean that it's going to affect your drug costs, because you might not have any tier 3, 4, or 5 drugs. So when we've been running prescription quotes for people, I think what we've seen is anybody that had really high name brand drugs, those people are saving a lot of money in 2025. Because of, which we'll get into later, but because of the Inflation Reduction Act, these companies have to pay more on the prescription drug benefit. So yes, companies have added drug deductibles. You might pay a little bit more in January or February for your prescriptions. But if you look at the 12 months as a whole, I could truly say that that people on Medicare, whether it's Medicare Advantage with Part D or whether it's a standalone drug plan, that drug costs truly have come down for people on Medicare. And a big reason they've come down is because the infamous donut hole, also known as the coverage gap, has been eliminated for 2025. So now you don't have to worry about your price spiking mid-year and doubling for your prescriptions. Now you have your deductible phase, you hit your initial coverage level, and then once you've hit your max, you go into catastrophic and you pay zero for all prescription drugs the rest of the year. So why were there so many changes to Medicare Advantage plans for the upcoming year? So this part is, partly speculation and partly research. Of course, I've done as much research as I can to find hard data, but make no doubt about it, the main reason Medicare Advantage plans have drawn back slightly on extra benefits is because they have to pay more on the Part D prescription drug side. And that is a byproduct of the Inflation Reduction Act. So yes, the prescription drug coverage does seem to be better for seniors, but it almost seems like the Medicare Advantage companies just kind of circumvented that, because in turn, they took out, as you saw from the data, they took out other benefits. So yes, the drugs are cheaper, but you're not getting as much over the counter, you're not getting as much transportation benefits, and all of the other ancillary benefits that we just described. So a lot of the main provisions in the Inflation Reduction Act do kick in 2025. One of the main provisions was the elimination of the donut hole. Starting in 2026, which not 2025, but 2026, is the first year where the negotiated drug prices will take effect on Medicare plans. So it's no coincidence that the Medicare Advantage plans just took benefits out, because they're now having to pay a much larger portion on the Part D drug benefit. Okay, so the second main reason that I believe that Medicare Advantage organizations took some of these benefits out is because the government has tweaked with the way they get their star ratings. So without going down the entire rabbit hole, these Medicare Advantage companies, they get a star rating from CMS, and that's 1 to 5 stars. The higher the star rating they get, the more bonus money they receive from the government. And with that bonus money, they're able to offer these extra supplemental benefits. So in 2022, 74 plans were rated 5 stars across the US. Well, 2025 is going to be the third straight year that is on a decline. So 2022, we had 74 5-star plans. In 2024, that number was cut down to 38. And now in 2025, there are only 7 5-star rated plans in the entire country. So if these companies are getting lower star ratings, they are getting less bonus money, less money that they are able to turn around and offer these extra supplemental benefits that Medicare beneficiaries have grown accustomed to since they were introduced in 2020. Now that was sourced from Certified.com, and again, that link is in the description below. And if I had to throw a third reason on why these plans have scaled back a bit, well, according to healthcarefinance.com, okay, they just are saying that overall plan utilization is on the rise. So that means that seniors enrolled in these plans, they are using more of the benefits. Now with 54% of the population being enrolled in Medicare Advantage plan, which is a record high, of course there is higher plan utilization because more people than ever are enrolled in these plans. Secondly, don't forget, we're coming off of the cusp of COVID. During COVID, you weren't even doing preventative visits, from 2020, 2021, 2022. So now with COVID being, fully done, seniors are getting out and they are utilizing their benefits more than ever, whether that's their dental benefits, their preventative benefits, or they're taking advantage of their supplemental benefits. So all in all, it was really just the perfect storm. The provisions in the Inflation Reduction Act, the way the government tweaked with the star ratings, and plan utilization being the highest it's ever been, the Medicare Advantage organizations made a business decision and they took out some of these extras. So all in all, guys, the sky is not falling. Medicare Advantage plans are still really, really strong and offer very attractive benefits. The Part D benefit, whether it's in a Medicare Advantage plan or in a standalone drug plan, is now stronger than ever because of the provisions in the Inflation Reduction Act. How things are going to play out in the next 3 to 4 years as other provisions kick in that bill, well, we don't know. But what we do know for now is the drug costs are a little bit cheaper for seniors. And in turn, it seems like the Medicare Advantage plans don't have quite the strength that they did the last 5 years. But by all means, they are still very solid plans. And you even saw from the data I provided, it has been scaled back, but not to the point where these things are not still available. So again, if you need information on any of these benefits or how it's going to affect you specifically, you could always reach out to our office at LMS Insurance Group. So guys, I thank you so much for watching. I'll talk to you next time. Larry Goist, LMS Insurance Group. Thanks.